usually the period, what we say sometimes menses or period or whatever, so it starts at the age of 9 to 11 years. It may vary from up to 8 years to up to 15 years sometimes. So that is also normal. So what do you mean by normal menstruation? So the duration, the color, the pain factor, the blood loss, everything I need to tell you in the brief, right? So duration, I would say the menstrual cycle is a 28 days plus or minus 7 days, right? So if you get a period within every 24 days, 25 days, it is normal. If you get delayed period by 2 to 5 days to up to 7 days, it is normal. So if you say like it is never a fixed date in anybody's life throughout the life, and it is never same in all the women, right? It goes on varying between the 28 days plus or minus 7 days. That is a normal range. Now whenever someone gets delayed periods and they are not thinking in terms of pregnancy, so anytime it's a myth, it's a dictum that if you get a delayed period and followed by normal or normal blood flow or a scanty blood flow, you not to worry about the treatment. If someone get very early period and little bit in excess, then you can seek a doctor's advice and you can come down to us, right? Now what do you mean by early period? So if someone get period 3 times in 2 months, that means if you ever get period every 20 days or less than that, and that remains for maybe a normal time, maybe 3-5 days, or it may prolong for up to more for the 7 days. So if you get the period within 3 times in 2 months, then it requires certain attention, so you should consult the doctor. Now regarding the duration of the bleeding, now whatever the inner lining is formed in the uterine cavity under the effect of hormones, it sets off in the form of menstruation when someone is not pregnant. So the shading of the inner lining, it may vary in person to person. So it is not so always so in all the women. So the normal duration of the menstrual cycle, it may be 3 to 5 days, maybe up to 7 days. So what is the exact medical term is, if you get the period for 1 day to up to 7 days, it is normal. So you may not seek an advice, because in some person the separation of the inner lining continuously takes place within the uterine cavity, and then with little bit of pain it comes out as a mass in the form of a blood clot, and then it stops the menstruation within 2 or 3 days. That is also a normal cycle. So normal blood loss is up from 5 ml to up to 80 ml. So the way of excretion of the inner lining, it may vary in person to person, and it may vary in same person in different stage of life. So that is not a important thing. So someone if bleeds for 2 or 3 days, it is perfectly fine. If she bleeds for 7 days, maybe manageable, not in excess form which leads to severe weakness, so that is also normal. So you may not seek an advice for that kind of thing. Now there are few questions about the color. Some says कि मेरा brown आता है, कोई बोलता है black, कोई बोलता है red आता है. So that doesn't signify a much kind of thing. The color may vary. As I told you, what is menstruation? It is the shading of the inner lining. When it comes out in the vagina, which is a potential space through which baby of more than 2.53 kg delivers out. So it is a potential space. So when the inner lining sets off in the vagina, it remains stagnant in the vagina, and then you go for the urination or something like that, it comes out in the form of a gus or a small blood clot. So that is not excessive bleeding, I would say. Second, once the blood remains stagnant in the vagina, the fluid portion will be absorbed. So it may change the color sometimes. It may be brown, it may be, if it remains for a long time, it may be black also. So again, that doesn't signify anything. So color, whatever, like kala aaya, katthai aaya, black aaya, it doesn't mean anything. It is not at all need to be require any kind of attention. So these are the few briefs I would like to say. And then nearing menopause, again around after 40 years of age, it is called perimenopausal age. In today's scenario, the menstruation age, it is prolonged in so many women. They are getting regular periods up to 50, 52, 55 years. So that doesn't, again, it is a normal womanhood, right? So what do you mean by menopause? When someone doesn't get the period at a stretch for the straight 1 year, it is called an established menopause. So before that, if you get delayed periods, irregular periods, perfectly fine. Now one more and last myth I would like to say, that usually what people believe that nearing menopause, vadhare मासिक आवे ज़्यादा आ रहा है, it is good, जाने वाला इसके लिए ज़्यादा आ रहा है. So it is nothing kind of that. The normal progression towards menopause would be gradual delay of the period, धीरे धीरे कम होके बंद हो जाना. So she may get period every 2 to 3 months, 4 महीना 6 महीने के बाद आता है। वंस 1 साल तक नहीं आया, दैट मीन्स शी इज एंटर इन एब्सोल्यूट मेनोपॉज। उसके बाद कुछ भी होता है तो वी हैव टू ट्रीट कि भाई क्यों हुआ ऐसा। पर जैसे कई लोग ऐसे आते हैं कि बहुत ब्लीडिंग होता है तो आजू बाजू वाले सब बताते हैं कि डोंट वरी, जाने वाला है, इसके लिए बहुत आ रहा है, तो दैट इज़ द वे इट विल बी कमिंग आउट, तो इट इज़ वेरी गुड। सो डोंट बिलीव इन दैट एस्पेक्ट। और लास्ट मैं पेन के बारे में बताऊंगी। पीरियड जब आता है सो दैट कुड बी अ पेन, दैट व्हाट वी कॉल इज डिस्मेनोरिया। सो देर आर फ्यू लेडीज लाइक फ्यू गर्ल्स, तो इतना पेन होता है तो दे टेक ए ब्रेक फ्रॉम द जॉब और स्कूल और वट एवर। सो पीरियड आना इट इज़ अ वेरी वेलकम साइन। सो वाई यू शुड बी असेन एंड वाई द वर्ल्ड शुड नो दैट यू आर इन द पीरियड। सो व्हेन यू आर नोइंग यू आर हैविंग ए पीरियड एंड व्हेन आपको पीरियड आता है तो यू आर हैविंग ए सीवियर पेन, so why not to take certain medication which the period will go unnoticed. It will decrease the blood flow also as by 40%. So पूरे महीने में 3 या 5 टैबलेट पेन किलर लेने से उसका कोई एडिक्शन नहीं होता है। देन आपको एक दिमाग में वो टेंशन नहीं रहता, पीरियड का एक टेबू नहीं रहता है, एंड देन पीपल डजंट नो दैट यू आर इन द फेज ऑफ द पीरियड। सो दो वी नो इट इज़ ए वेलकम एविडेंस, बट देन द सोसाइटी स्टिल they don't accept that menstruating girl, they will look at the different way. We go to the school, friends होते हैं वो भी देखते हैं कि इसको ये है, इसको ये है। So don't do that way. सब मम्मी को भी मैं इंसिस्ट करूँगी कि whenever बच्ची को पेन होता है उनको पीरियड आने से पहले एक्सप्लेन कीजिए। एंड पेन किलर का ऐसा है कि when you take a पेन किलर टेबलेट, there is severe pain, उसका इफेक्ट इतना अच्छा नहीं होता है। सो व्हेन यू आर अवेयर कि आपको हर महीने पीरियड में पेन आता है, सीवियर पेन होता है, तो ये एक्सटेंड आपको सो जाना पड़ता है, इंजेक्टेबल लेना पड़ता है। सो आई वुड इंसिस्ट कि जब भी आपको पीरियड आता है, एज सुन एज यू स्टार्ट लिटिल हैवीनेस, you take the tablet so the effect will be good of the medication also. When on the peak of the pain, if you take the medication, it may not be that much effective. So 2 or 3 or 5 tablets a month, it is perfectly all right in any age group. So it should be taken without any worry. Thank you.